Now, it's been a huge project lasting more than 15 years and costing almost £500 million. But finally, the redevelopment at the Royal Sussex County Hospital in Brighton is set to open its doors to patients in a few months' time. It will offer more than 30 new wards and departments, replacing parts of the hospital that were built almost 200 years ago. Here's our health correspondent, Mark Norman.
It could be the view from an expensive penthouse apartment in Brighton, but turn around and you realise it is in fact the view from one of the new wards in the new hospital being built to replace large parts of the existing Royal Sussex County Hospital in Brighton. Many staff at the Royal Sussex are still working in wards built in the 1820s. The staff moving into these wards are understandably excited.
It's going to provide us really with huge impact, especially for our ward. We've been in the Barry building for many years, and it's been really challenging to work in a very restricted space as well. So this is a very openly positive, welcome addition to the team as well. It will benefit patients and staff alike.
On our escorted look around, it's difficult not to be impressed. The new buildings will provide more than 30 new wards and departments, a state-of-the-art major trauma care, new teaching facilities, and a new critical care facility.
We're bringing together our high dependency units, our intensive care units into one unit across the whole floor. And that basically it gives us better patient outcomes and gives us the space to expand if we need to.
It's hoped it will also encourage staff to both join the trust and help retain the ones they already have.
At the moment, we're a split team, so we run across a few sites, and moving into here, it's one big department. So our teams will be together. We're doing a lot more joined up working together. So that's really exciting, as well as having the actual new environment.
This is the entrance, more than 20 times the size of the existing reception area. With 1 million patients, visitors and staff expected to pass through the doors in its first year. But with any project of this scale, there are the inevitable questions. Is it on budget and is it on time?
So we've invested just under 500 million in this amazing facility. Our contractors worked on site during the whole of COVID, and during that time we agreed a revised opening date with our contractors, who we've had an amazing relationship with.
So yes, a little over the original £485 million budget and a little late in delivery, but perhaps to be expected given the pandemic. What's not yet known is what this building will be called, and the Trust are asking us, the public, to name it before its opening in 6 months' time.
Well, Mark's there for us now. Mark, this is an important building, not just for the Trust, but for the whole of Sussex.
Indeed, Charlie. We've given you, by the way, a slightly unusual camera angle so you can see as much of the building as possible. This was first discussed in 2008, the business case made in 2016, and here we are in 2022 with the doors going to open in a few months' time. But as you say, really important for the county, this will be the major trauma centre for Sussex. And in phase 2, they will be building the Sussex Cancer Centre in a brand new building as well. But look, it's going to provide excellent patient care, hopefully, in these sorts of facilities. Much better experience for visitors as well. And then crucially, as you heard in my piece, to recruit and retain the very best staff. And Charlie, if you have a name for the building, the Trust are still looking for that. You can do that through their website.
Mark, I'm working on it. Thank you very much.